Robin saved my life.
Janice Breyer is a heart patient. Her hero is a nurse named Robin Thomas.
The night that I flatlined here at the hospital, she jumped on and she gave me life again. They give of themselves to us as patients is more than we could ever thank them for. And I think they need to be recognized for that. From the bottom of my new heart, she deserved it.
Right. Dr. Jessica Benson-Haver was her last stop. The director of the breast oncology program at the Henry Ford Cancer Institute says Wokulski's case was unique.
Although she presented with an early stage breast cancer, it was an aggressive tumor. She was a young age and she had a very significant family history that fell through her father's side. For those reasons, we were highly suspicious that she was likely a mutation carrier.
Meaning Wokulski might have the BRCA1 or BRCA2 gene, indicating she has a much higher than average risk of developing breast cancer. So even though the genetic testing had not even come back yet, Dr. Benson-Haver recommended a double mastectomy.
It felt right. It felt peaceful. And she explained why this would be a good choice.
Within 3 days, she had that double mastectomy, followed by 4 months of chemo, surgery to remove her ovaries, then reconstruction. In the middle of it all, the genetic test came back, and sure enough, she was positive with the BRCA1 gene.
New type of healthcare coverage to employees. You like this?
I love one ironic piece of this. It's with the Henry Ford healthcare system. That's really cool. But we've seen this happen. Intel has done it. Walmart has done it regionally. Companies that have a strong regional presence in one area can really make some higher quality healthcare provision at a lower cost for their employees. I'm all for that.
In 2016, I came to the Hermelin Brain Tumor Center because I began having symptoms. My left hand was losing its function, my motor skills were becoming tremendously weak, and I wasn't really sure what was causing that, and so I got an MRI scheduled and saw Dr. Walbert right after just to find out that I had another recurrence and would need a surgery again. So that would be my 4th surgery in 2016.
We are living through one of the most exciting inflection points in the history of cancer and for brain tumors and for neurosurgery in particular. There's never been a more hopeful time. We are literally using space-age technology in the operating room. So neurosurgeons now have the ability to look in real time into a patient's brain and understand the specific tracks that control motor and speech and thought processes lighting up right next to the approach that we know we're going to have to take to attack a tumor.
News this morning from Dan Gilbert. The Quicken Loans founder tweeted that his son Nick is home from the hospital this morning. He had surgery for a brain tumor and was in the hospital for 38 days. Gilbert's tweet thanked the surgeons at Henry Ford Hospital for their innovative approaches and for winning the fight versus brain tumors.
The transplant was a success, like so many others over the last 50 years at Detroit's Henry Ford Hospital. Many donors, recipients, and doctors also gathered to celebrate the launch of the Center for Living Donation, a new facility that focuses on the donors, who Dr. Jason Denny calls angels on earth.
Donors need their own specific doctors, nurses, and people to discuss them specifically. And that's what the center will do. It's a concierge level of care for people who are giving selflessly to those in need.
I think one of the things that makes our program unique is just the innovative spirit of Dr. O'Neill, who leads the program, and our entire team. They're not afraid to look at a problem and try and say, we have an answer. Let's figure this out.
When Pat goes in for therapy, she sits and the exoskeleton is strapped to her legs and feet. It gives her support, but also bridges the gap between her own weakness and her brain learning how to walk again.
I mean, she couldn't move her leg, she couldn't move her arm. And yesterday she went up and down a flight of stairs twice, which, I mean, how amazing is that?
A new $20 million donation will be used to create a pancreatic cancer center at Henry Ford Hospital. The facility is expected to have an impact locally and nationally through collaborations targeted at early detection. Dr. David Kwan is Director of Surgical Oncology and Director of the new center.
We're going to be focusing on a few concerted efforts, and those include the early detection of pancreatic cancer, as well as developing biomarkers to help identify and diagnose these pancreatic cancers even earlier than what can be diagnosed in its current state.
We are so excited to be at the site of our new Brigida Harris Cancer Pavilion, which will open up in 2020. It's going to be a comprehensive cancer center bringing together our best specialists, multidisciplinary approaches, integrated medicine, and a healing environment. Earlier today, we had a wonderful ceremony, a topping off ceremony, which really honors the iron workers and the incredible talent of our local Detroit area skilled trades that are putting this fabulous cancer center together. In addition to this 187,000 square foot building behind me, we have a new performance center and sports medicine center going up a few blocks away in our new relationship and partnership with the Detroit Pistons. It will also be their corporate office. We're going to have an orthopedic specialty services, team-based clinics for high schools, for college students. Anyone that's leading an active life is going to find something of value in that sports medicine center. We are building a new state-of-the-art ambulatory center on Telegraph Road just north of Square Lake to really meet our community's needs for care close to home. And this will have all of our primary care, specialty care, diagnostic care, one-stop shopping, one place.
This is the Brigida Harris Cancer Pavilion, the future home of cancer treatment, clinical trials, and research. The president and CEO of Henry Ford Hospital told the crowd this new facility sits on a foundation of hope.
While we're very excited about the building that's going up behind us, what we're more excited about is all the things that will happen, all the innovative care that will go on, all the innovative research that will happen, and frankly, we're excited that we will change lives.
The hospital showing off the county's first hybrid operating room. It allows doctors to do many different surgeries all in one room. It's modern technology delivered in a safe, efficient way.
On behalf of Henry Ford and SciAps, we're honored to fulfill our commitment to share data in the service of our patients, to alleviate suffering, and to provide hope.
ISEM introduces us to 3 generations of women dedicated to giving back to their community with canines by their sides.
3 generations. I take after my mom, and my daughter takes after me.
Yeah, we're definitely a therapy team, you know. One doesn't work without the other.
Grandma Joanne, her daughter Helene, and Helene's daughter Mallory.
We bond with each other, the dogs bond, and we bond with all the patients and everybody that we see.